How do chemical indicators ensure plastic surgery sterilization? Imagine a tiny color-changing badge that tells you if your surgical tools are truly clean and safe to use. That's what chemical indicators do in plastic surgery sterilization. They are vital tools that help verify whether sterilization processes have been successful. These indicators contain special chemicals that react when exposed to the right temperature, pressure, and sterilant conditions. When the correct sterilization cycle occurs, the chemicals change color, providing a clear visual sign that the instruments have been properly sterilized. This immediate feedback is crucial because it helps surgical teams confirm that their sterilization equipment is working correctly and that instruments are free from harmful microorganisms. In plastic surgery, where infection prevention is essential, chemical indicators act as a frontline check. They are placed on instrument packaging or pouches before sterilization. When the cycle completes, staff can quickly see if the indicator has changed color, indicating the process met the necessary conditions. If the color does not change, it signals that the sterilization may not have been effective, prompting further action. This helps prevent the use of contaminated instruments, which could lead to infections or complications after surgery. There are mainly two types of chemical indicators. Process indicators are the most common. They appear on packaging and change color when exposed to sterilization conditions. These help distinguish between sterilized and unsterilized items at a glance. The second type is specific to the sterilization method used. For example, indicators designed for steam sterilization respond to high temperature and pressure, while those for ethylene oxide gas or hydrogen peroxide plasma respond to their unique parameters. These tailored indicators ensure that each sterilization process is accurately monitored. The color change in these indicators is straightforward for sterile processing staff and surgeons to interpret. They can quickly assess whether the sterilization cycle was successful. However, it's important to note that chemical indicators do not directly measure whether all microorganisms have been killed. That's why they are used alongside biological indicators, which contain spores resistant to sterilization. Biological indicators provide a more definitive test of sterilization effectiveness, confirming that the process achieved the necessary microbial kill level. Together, chemical and biological indicators form a comprehensive system that ensures the highest standards of instrument safety. They help maintain compliance with sterilization standards set by health authorities and regulatory agencies. In the end, these indicators support the core goal of patient safety by confirming that surgical tools are properly sterilized before use. Always remember, for the safest outcomes, sterilization should be monitored carefully with multiple tools, and healthcare professionals should follow established protocols and guidelines. If you have questions about sterilization procedures, it's best to consult with trained sterilization specialists or medical professionals to ensure everything is done correctly.